How do you relieve breast engorgement? If you're a new mom experiencing the discomfort of breast engorgement, you're not alone. This common issue can be quite painful, but there are several ways to find relief. First, let's understand why breast engorgement happens. It usually occurs when milk builds up in the breasts and isn't fully emptied during nursing or pumping sessions. This can happen around 2 to 4 days after the baby's birth. One of the most effective ways to relieve engorgement is to nurse your baby more frequently. Let your baby feed on demand and make sure they nurse for as long as they want. This helps to empty the breast and reduce the buildup of milk. If your baby isn't hungry, you can use a breast pump to express some milk and relieve the pressure. Gentle massage can also be very helpful. Before and during breastfeeding, gently massage your breasts to help soften them and improve milk flow. You can use a technique called reverse pressure softening to push fluid away from the nipple, making it easier for your baby to latch. Warm compresses or showers can also stimulate milk letdown and make feeding more comfortable. Try feeding your baby right after a warm shower or apply a warm, moist towel to your breasts for a few minutes before nursing. If your breasts are too hard for your baby to latch, you can hand express or pump a small amount of milk to soften them. Just be careful not to express too much, as this can stimulate your body to produce more milk. Cold compresses or ice packs can help reduce swelling and pain. Apply them for no more than 20 to 30 minutes between feedings to avoid overcooling the breast tissue. Another tip is to ensure your baby is latched correctly and feeding effectively. Sometimes, a poorly positioned latch can lead to incomplete emptying of the breast, exacerbating engorgement. If you're unsure, it's a good idea to have your baby's latch and positioning checked by a lactation consultant. Avoid wearing tight bras or clothing, as these can increase the discomfort and potentially lead to blocked ducts or mastitis. Take off your bra completely before breastfeeding to help your baby latch better. If your baby is sleeping longer or not feeding as frequently, wake them up for a feed if your breasts become full and uncomfortable. This is especially important at night to prevent engorgement from worsening. Finally, if you're still experiencing discomfort after trying these tips, it's a good idea to talk to a lactation consultant or your doctor for further advice and pain relief options. Remember, breast engorgement is temporary, and with the right strategies, you can manage the discomfort and ensure a smooth breastfeeding experience.